Good morning, everyone. The topic for today's discussion or the topic for today's lecture is on the various principles of primary healthcare. So in the last few classes, we have seen how primary healthcare as a concept evolved, what are the various characteristics of it. We also learned it is placing people's health in people's hands. It is actually based on 5 important principles. So which are the 5 important principles? So one is, the first and foremost is equitable distribution. Equitable distribution. So primary healthcare is based on equitable distribution. Okay. So what do you mean by equitable distribution? So if you see the cartoon here, okay. So if you see it, you can see there is equality and equity. Do you think the words are the same? No, they are quite different. Right, if you can see here, equality is providing an equal share to everyone, irrespective or taking no consideration of their background or of their, we can say, any other parameters. But equity is giving or making sure everyone gets the same. Everyone gets the same result by certain, what you can say, putting into consideration their economic disposition, their background, etc. Okay, so this is applicable to primary healthcare also. So the health services must be shared equally by all people, irrespective of their ability to pay, whether they are rich or poor, whether they are from an urban background or a rural background. Okay, that means they must have access to the healthcare equally. All right. So though we try to provide or bring about equity in our distribution, we rather mostly end up in equality, or we can achieve equality far better than equity. So primary healthcare is striving to provide healthcare equitably. Okay. At present, if you see, health services are usually concentrated in major cities and towns. Even if you guys pass out, okay, or become a dental professional, how many of you would like to put up a clinic in a rural village or a rural setup or in a village in a what you can say, poor economic background area? I don't think really few, right? Very rare. It will be very rare. Similarly, nowadays, even if we fall sick, we go to a hospital which is at a city or in a town, right? So that is what is happening in the current scenario. And the worst hit usually are the needy and the vulnerable groups of population living in the rural areas and urban slums, right? That is the stark contrast which we face, or the dire reality which we face today. And that term, okay, and we call it as social injustice. So primary healthcare, you actually aims to shift the center of gravity of healthcare system from the cities or from the well-off areas to rural areas and bring these services to as near to the people's homes as possible. That is what is the aim of primary healthcare. Okay. The second important principle is community participation. Community participation. It is nothing but, as a word, from the word itself, you can understand what is this principle. For anything to be successful, and if you are planning it for a community as a whole, it should involve, or it should bring about the involvement of individuals, families, and communities in promotion of their own health and welfare. That is, the community must involve the community as a whole, okay, not just the stakeholders or the presidents, okay, but the representatives from each group at least should involve in planning, okay, in its implementation and maintenance of health services, okay. And community participation not just means involving yourself in program planning or implementation and maintenance, but it also involves providing people as a resource for the program, like in case of manpower, money, materials, and time. Okay. So if everything comes together, then it is going to be a success, and that is known as a community participation as a whole. So we can see in India, we have village health guides and trained guides. Okay, they provide primary health care by overcoming cultural and communication barriers in ways that are acceptable to the community. That is one pure example of community participation. In China, they used to have community participation in the form of barefoot doctors. Okay, barefoot doctors were there in China, so they used to go door to door providing healthcare. Then the third important principle is intersectoral coordination or multi-sectorial approach. That is basically planning with the other sectors to avoid unnecessary duplication of activities. So you catch hold of people from other different sectors, okay, not just health, but from other sectors, and then you work together as a team. So primary healthcare involves, in addition to health sector, all related sectors and aspects of national and community development. That is like agriculture, you have to include animal husbandry, then you have to take into consideration food industry, education, housing, public works comes in. Okay, if you think of providing proper water and sanitation, of course, public works comes in. Your transportation, everything. Then communication and other sectors. Okay. So the various areas of intersectoral coordination are promotion of nutrition, agriculture, education, social welfare, panchayat, and animal husbandry. So the major reason for lack of success of many oral health programs is the fact that they operate in isolation. They are concentrated only in one place. They work on their own, okay, and they leave the place. That is, they are usually working separate from general healthcare structure. So that should not happen. We should somehow integrate into the general healthcare structure. Then only we can make sure it is a lifelong process. So oral health could better be integrated into general health programs by tackling common causes, by including oral health in general health, education at least. Then the fourth important principle of primary healthcare is appropriate technology. So appropriate technology is defined as a technology that is scientifically sound. It should be adaptable to local needs, okay, acceptable to those who apply it, and then it can be maintained by the people themselves. So these are the four important points for a technologically sound or a scientifically sound technology. This applies to using costly equipment, procedures, techniques when cheaper, scientifically valid and acceptable ones are available. So that means the technology should also be effective. It should be acceptable to those who apply it, acceptable to those who use it, in keeping with the local culture. Okay, it should not be a very bogus idea for them. They should comprehend what you are going to provide them, first of all, and they should have that felt need for a betterment. Otherwise, whatever new technology you are going to administer to them will utterly fail. And it should be capable of further development. It should be simple to design and use, easily understood by people, easily understood by the health volunteers also, because they are also mostly from, all these health volunteers are normal common man. They might not be from the health background. So it should be easily accessible to understood by them also. Okay. And the last and the important principle of primary healthcare is focus on prevention. It should always focus on prevention. This means that whatever health services should, however, not only be curative. It is not always the curative end that we are focused on in primary healthcare, but it should also promote health and healthy lifestyles with always the emphasis on prevention, because one of the elements of primary healthcare which we learned was immunization. So immunization is actually, that is, why is it a component? Because we are focusing more on prevention. Okay, so that is all for today. So the 5 important principles of primary healthcare which you have to know are, what is it? It starts with equitable distribution. Okay, then community participation, intersectoral coordination, okay, multi-sectoral it is, and then you have, what else? Appropriate technology and focus on prevention. Thank you.